uh, Charlie वाला auto is लेकिन
Assalamualaikum sir.
হ্যাঁ ওয়ালাইকুম আসসালাম
স্যার আজকে 9 থেকে পড়ানোর কথা।
9 থেকে পড়ানো ভেরি গুড থ্যাংক ইউ হাউ আর ইউ
জি স্যার ভালো, আপনি ভালো আছেন? জি স্যার।
ভালো আচ্ছা থ্যাংক ইউ card number 9. So first question, what are the causes of sinus bradycardia? I think you know bradycardia means when pulse rate is below 60 beats per minute. And the pathological causes of bradycardia are MI. Number one. Number two, sick sinus syndrome. Sick sinus syndrome is a arrhythmia which is characterized by tachycardia followed by bradycardia. Sick sinus syndrome is a arrhythmia which is characterized by tachycardia followed by bradycardia. This is sick sinus syndrome. And MI, myocardial infarction, it may cause bradycardia. So these are the two causes. Third, obstructive jaundice. And I think now you know what is obstructive jaundice. And fourth one is hypothyroidism. It is also known to you. Fifth is RICP, means raised intracranial pressure. And the character of raised intracranial pressure is headache, bradycardia, hypertension, vomiting, and papilledema. So these are the different findings of raised ICP. And some drugs, especially beta blocker, which is commonly used in tachycardia, and digoxin, which is commonly used in atrial fibrillation. These two drugs causes bradycardia. Hypothermia, very uncommon presentation, but hypothermia means when in body temperature. Now the causes of sinus tachycardia. Tachycardia means when the pulse rate is more than 100 beats per minute, and the pathological cause of tachycardia fever. Fever means when body temperature is more than 100.4 degree Fahrenheit. Anemia, heart toxicosis, heart failure, pheochromocytopenia. It is the benign or malignant tumor of the adrenal medulla. And drugs, salbutamol. So these are the common causes of sinus tachycardia. Now the causes of optic atrophy. Optic atrophy means the pale discoloration of the optic discs. Normally optic disc is partly white and partly red. But if it is completely white, then it is called optic atrophy, pale discoloration of the optic discs. And there are two types of optic atrophy. One is primary, another is secondary. Primary, it may be familial. It may be multiple sclerosis. I think you know what is multiple sclerosis. Multiple sclerosis is a demyelinating disease involving the brain and spinal cord. Neurosyphilis, it is a variety of syphilis, and vitamin B12 deficiency. And among the drugs, ethambutol. Ethambutol is a drug which causes optic atrophy. So when we will prescribe ethambutol for tuberculosis for long term, then we should see the optic discs by ophthalmoscopy. And secondary, optic atrophy is caused by long-term papilledema. Now, what are the causes of dysphagia? Dysphagia means difficulty in deglutition. And the achycardia, it is not so common, but it usually occurs in young patients. Is esophagus, it occurs in elderly patients. Candidiasis, it occurs in young patients. Is stomach, elderly patient. Bulbar palsy, it may occur in both your adult and elderly patients. pseudobulbar palsy and bulbar palsy. These two terms is very important. Bulbar palsy means when the lesion in the medulla oblongata, and pseudobulbar palsy means when the lesion in the tract coming from the spinal cord and ending in the medulla oblongata. So, as per human corticobulbar fiber, if the corticobulbar fiber has lesion, it is called pseudobulbar palsy. But when the medulla oblongata directly involved, it is called bulbar palsy. Myasthenia gravis, I think you know, it is a neuromuscular junction dysfunction. It is autoimmune disease. Now, what are the predisposing factors for gout? And the predisposing factors for gout are drugs, thiazide, diuretics, and pyrogenomide. Pyrogenomide very commonly produces gout. So when you are prescribing pyrogenomide, you should see the serum uric acid level and let test after 2 weeks. And thiazide, diuretics also. CRF at latest stage can produce gout. And CML, chronic myeloid leukemia, CLL, chronic lymphatic leukemia, and familial predisposition has sometime present. High protein diet, especially red meat and alcohol, high intake of alcohol, these two are the dietary factors that produces your gout. Our next question, what are the deficiency causes of vitamin K? That means, what are the causes of vitamin K deficiency? One is your obstructive jaundice. Obstructive jaundice, because you know, in case of obstructive jaundice, there is no process of bile from the gallbladder to the and to the small intestine. So there will be no absorption of fat soluble vitamin, that is K. So there will be deficiency of vitamin K. Malabsorption, synonymous, there will be no absorption of your fat soluble vitamin. And newborn baby suffers from vitamin K deficiency. What is Hansen's disease? Hansen's disease is a leprosis caused by your Mycobacterium lepra. So it is a disease caused by Mycobacterium lepra. So leprosy, another name is Hansen's disease. And what are the characters of autosomal dominant disease? It is a genetic disease which is expressed in heterozygous state. That is, either mother or father is affected, then the offspring will be affected. It is the main character of autosomal dominant disease. Second, both male and female offspring are affected. Now, sex predominance. Third is mutation occurred in structural protein defect. Mutation of the gene in structural protein. And 50% of the offspring of the affected parents will be affected and 50% will be normal. And no one is carrier. There is no carrier system in autosomal dominant disease. What is septic arthritis? It is a medical emergency where most rapid and destruction of the joint occurs. And it is presented with acute monoarthritis and high fever. Joint is swollen, hot, red, and effusion present. So it is a medical emergency involving the single joint, and the joint is very hot, red, and swollen, and it is associated high fever. So this is the character of septic arthritis. What are the symptoms of OPC poisoning? Bronchoconstriction, spasm, bronchodiuria, secretion to the oral cavity for the salivation will come out. salivation, meiosis, constriction of the pupil, muscle fasciculation, twitching of the skeletal muscle of the body, ataxia, coma, confusion, convulsion. These are the different and presentation of OPC poisoning. Now we'll go to come to card number 10. What are the long-term complications of the hypertension? Cardiac complication, ischemic heart disease, and left ventricular failure. In brain, there is stroke. I think a stroke, you know, a stroke is a rapid onset of focal neurological deficit or focal neurological deficit of brain function, which is vascular origin. So stroke is a rapid onset of focal neurological deficit of brain function due to vascular cause. It is a stroke. And subarachnoid hemorrhage means hemorrhage in the subarachnoid space. In kidney, there may be CKD, chronic renal failure. In eye, there may be hypertensive retinopathy. In hypertensive retinopathy, we will ultimately get the papilledema. And before this, you will get exudation, silveroiding, etc. What are the complications of a stroke? First complication is hospital-acquired pneumonia, which occurs within 48 hours of hospitalization of a stroke patient. Next is epilepsy. Epilepsy is a abnormal neurological event characterized by convulsion, and it occurs or say in stroke. Next is frozen shoulder, spelling mistake FROJDN, frozen shoulder, stiffness of the shoulder joint. DVT, deep vein thrombosis, unilateral leg swelling occurs, bed sore, skin soreness in the back, retention of urine and distension of urinary bladder, incontinence of urine. There is no control over the urination, and depression and anxiety, the patient will suffer. Now, what are the causes of vomiting? It is a very common presentation. And GIRD cause peptic ulcer disease, cholecystitis, pancreatitis, intestinal obstruction, gastric cancer, acute appendicitis. These are the GIRD causes. And in CNS causes, meningitis, vestibular pneumonitis, stroke, migraine, subarachnoid hemorrhage, and raised ICP. Now, what is genetic counseling? It is a process of providing information about medical and familial affairs in non-directive manner. It is a process of providing information. What information? Regarding medical information, regarding familial affairs. That is, if the pregnancy is continued, what are the family members may be affected, or what type of disease the family members may affected. So this information, it is the genetic counseling means the providing information regarding the medical and the familial disease in non-directive manner. Doctor will not guide to the patient. Doctor voluntarily asks the question to the patient whether this will happening in the family members, whether the patient can continue pregnancy or not, but never insist for abortion, never insist for termination of pregnancy. The patient will voluntarily take decision. It is the main perspective of your genetic counseling. The problem solved by genetic counseling, and these are assessment of the genetic risks. What are the problems we can solve by genetic counseling? First one is we can assess the genetic risks. Second, we can identify the children at risk, coming offspring at risk, and paternity detected by DNA test. Paternity, if there is any confusion of paternity, then we can confirm it by DNA test. So it can be done by genetic counseling. And increase risks in consanguinity. Consanguineous marriage have greater chance of genetic disease. So all this information should be conveyed to the patient, and patient will take decision whether he or she will continue the pregnancy or terminate the pregnancy. This is the purpose of your genetic counseling. So genetic counseling is the conversation between the medical personnel and the patient regarding the disease, especially genetic disease, and its effects in the family. What is the function of vitamin A? The increased immune function of the body. It increases immunity of the body. It has some anti-inflammatory effect by preventing free radical injury, and it prevents cell dying by free radicals. Free radical injury to the cell can be prevented, and it maintains cell membrane structure. It maintains the cell membrane structure. Thus, it protects the cell membrane or cell from free radical injury. Now, what are the clinical presentation of meningitis? It's very simple: fever, headache, vomiting, and loss of consciousness. And if this symptom is severe and it is rapid, more likely it is pyogenic meningitis. But if the symptom is mild and for prolonged time, it is tuberculosis. But if the symptom is very short time but not so severe, then it is viral meningitis. And this sign, neck rigidity, cardiac sign, and Bradycardia sign, all this sign you will get in case of pyogenic meningitis. But in tuberculosis meningitis, you can get some of the neck rigidity, cardiac sign. In viral meningitis, all signs may not be present. Give example of X-linked recessive disorder: hemophilia A and B, Duchenne muscular dystrophy, and Becker's myopathy. So these are the 4 diseases involved in X-linked recessive disorder. What investigation it will do for rheumatoid arthritis? In blood, yes sir, will be high. C-reactive protein will be high. Anti-CCB antibody highly specific. This is recent test. And our test is positive in 70% cases. Anemia of chronic disease is present in case of rheumatoid arthritis. And X-ray hand, you will get soft tissue swelling, reduction in the joint space, periarticular osteoporosis, marginal sclerosis, and marginal erosion of the bone. What is the causative organism of collagen? Our last card, number 11. What are the clinical features of cardiogenic shock? And the cardiogenic shock, so the features of shock will be present in this patient, like your hypotension, that means systolic blood pressure less than 90 millimeter of mercury, and Oliguria, when urine volume 24 hours urine volume is less than 400 ml. Tachycardia, heart rate more than 100 beats per minute. Patient is in confusional state. Skin is cold and sweating present. These all the features of shock will be present in a patient of cardiogenic shock. And other features of the disease, underlying disease may present. If chest pain is present with above features, that indicates the shock is due to myocardial infarction. If a palpitation and syncopal attack occurs frequently, it is due to hypertrophic cardiomyopathy. And if patient has got dyspnea, especially paroxysmal nocturnal dyspnea, dyspnea on exertion, orthopnea, and even dyspnea trace that indicate with basal crepitation that indicates patient is also suffering from LPF. And features of pericardial tamponade and like dyspnea, tachycardia, and raised JBP pulsus paradoxus. So if dyspnea and raised JBP and pulsus paradoxus present, that indicates the shock has developed due to cardiac tamponade. What is epilepsy? Epilepsy is a clinical event caused by hyperexcitability of the cerebral neurons due to abnormal electrical impulse characterized by repeated convulsion with or without loss of consciousness. So epilepsy is a clinical event caused by hyperexcitability of the cerebral neurons. This is the cause. And what clinical event occurred? That clinical event is characterized by convulsion with or without consciousness. This is your epilepsy. What are the causes of lower GIT bleeding? Rectal polyp in case of children causes lower GIT bleeding. Hemorrhoids in adult patient produces your bleeding. And C rectum in elderly patient produces lower GIT bleeding. Ulcerative colitis in middle-aged patient also produces lower GIT bleeding. What are the diagnostic features of SLE? First one is butterfly rash. Second is your oral ulcer. Third, photosensitivity. Photosensitivity means irritability and itching on exposure to sunlight. Discolored rash in the skin of the body, disc-like rash occurs. And arthritis is plating type arthritis. Large joints commonly involved. Serositis, like your ascites, pericardial effusion, pericardial effusion can occur in serositis. Anemia, especially your congenital hemolytic anemia, leukopenia, thrombocytopenia, all these are the blood picture. Renal proteinuria is a common presentation in lupus.
ঠিক আছে স্যার।
ঠিক আছে? ঠিক আছে?
জি স্যার।
এখন ঠিক আছে? আচ্ছা, ঠিক আছে। দেখা যাচ্ছিল না। আচ্ছা। And in CNS involvement, there will be psychosis and seizure. Seizure means convulsion. And I think you know what is the difference between seizure and epilepsy. Repeated seizure is known as epilepsy. And the mechanism of seizure and mechanism of epilepsy almost same. And some immunological investigation like anti-double stranded DNA antibody. Another antibody that is your anti-Smith antibody. So it is commonly asked what are the antibody detected initially. Then you will tell two antibodies. One is anti-double stranded DNA antibody, another is anti-Smith antibody, SM antibody, anti-Smith antibody. And ANF It is immunological test, ANF antinuclear factor, antinuclear factor. So total 11, 9 clinical criteria and 2 immunological criteria. Total 11 criteria for diagnosis of SLE. Out of the 11, if 4 criteria is present, then it is diagnosis of SLE. Now, what are the clinical features of scabies? The presentation of scabies in adult and child is different. In adult, the maculopapulovesicular rash in the interdigital space of the hand, and genitalia are also involved. So interdigital area of the hands and genitalia commonly affected in adult person, and the rash is macular rash, papular rash, vesicular rash, and there are some barrow you can say in the interdigital area. In this barrow, mites are present. If you can collect the mite by blunt scalpel and see under microscope, you can detect, confirm the scabies. And in children, there is pustular rash, pus forming rash in the palm of the hand and sole of the foot. So this is the difference between presentation in adult and children. What are the examples of autosomal recessive disorders? Autosomal recessive disorders we have already discussed. It is a variety of disorders which the offspring are affected when both mother and father are affected. And the disease are Wilson's disease. Wilson's disease, I think you know, there is impaired metabolism of copper. So copper is not excreted from the body and it is deposited in 3 organs. Liver produces cirrhosis. In the brain, it produces your some neurological manifestation like your tremor, and in the eye it can produce a scapeting, Kaiser-Frazer swing. So this is Wilson's disease. Hemochromatosis means excessive accumulation of iron in the vital organs like your pancreas. So pancreatitis can occur. In the liver, cirrhosis can occur. In the testes, the testicular atrophy can occur. In the skin, black pigmentation of the skin can occur. These are hemochromatosis. Alkaptonuria, alkapton, and it is excreted through urine in this disease. And beta thalassemia, I think you know, a beta thalassemia is characterized by presence of your fetal hemoglobin. 97% fetal hemoglobin is present, and it is clinically characterized by anemia, splenomegaly, and hepatomegaly. Cystic fibrosis. In cystic fibrosis, there is the patient suffers from chronic respiratory disease like your bronchiectasis from childhood. So this is cystic fibrosis. And another one is albinism. In albinism, there is whitening of the skin. There is no pigmentation in the skin. White skin, even scleral cornea is also white. It is due to lack of pigmentation in the skin. Friedreich's ataxia. It is a variety of ataxia in occurs. Friedreich's ataxia. And in Friedreich's ataxia, the patient suffers from ataxia and pescavus, and ultimately paraplegia occurs in this patient. Phenylketonuria is another disease. Now, what are the toxic effects of vitamin A? Vitamin A is a very important disease which is responsible for your color vision and your night vision. But if it has some toxic effects in high dose, it can produce liver damage, it can cause hair loss, it can cause headache, it can cause double vision, and it can cause also teratogenicity. Now, what are the skin lesion in leptomeningeal leprosis? The first is your skin change in leptomeningeal leprosis, maculopapular rash with hypostasia, involving widespread skin and of the body, which is superficial, not symmetrical. Now, both sides of the body will be affected. Widespread area of the body will be skin of the affected, and the skin will be macular depigmented rash, localized depigmented rash, sometimes papules, and that macular rash is hyposensitive. And skin of the face is different. It becomes thickened and it is nodular, and there is loss of eyebrow and giving the appearance leonine face, look like lion. So this is the end of today's class. We have completed 3 cards, about 28 questions. So I like to orientate you the common question that will be asked in Viva, and if you can read and memorize this question and you can tell it in the board, then you have chance 50% chance of pass. And then another 10% possibility if you can go through the book a single time, then you can open the mouth and you can answer 10% question. And if you can answer the 60% question, you will pass in Viva. And those who want to do better result, they should go through the book. They should go through the book and they should have sound knowledge. If you want to achieve 70-75% and above marks, you have some concept, clean cut concept over the disease, so that any question is not missed. So this is the way of doing pass and doing good result in order. So this question, and I will teach you 400 questions over the 12 or 14 system. And if you can read it, if you can memorize it, you have 50% chance. And if you are lucky, even you can 60% chance. That is pass of Bible. So I pray to Almighty God for your good health and mental peace, and hope you will continue your study at least 6 hours daily, and then you will, after opening the class, you will just see the patient and sit for exam. Thank you all. Thank you. Thank you.